Hello, and welcome to Hard Conversations. This is a podcast about male sexuality, intimacy, and sex positivity, where we unpack the taboo topic of erectile issues in a safe, non-judgmental space. And now, here's your host, sex therapist, Timothy Norton.
Hello, and welcome to Hard Conversations. My next guest, Dr. Natalia Zhikhareva, known as Dr. Z, is a clinical psychologist specializing in gender issues and transgender care, and has worked with gender-diverse individuals for over a decade. Her passion working in the transgender community fostered an interest in clinical research, leading to the publication of an article entitled Pre-Operative Trans Women's Perceptions of Their Genitalia. Dr. Z's most recent work includes speaking on the effects of gender transition on sexuality at the Los Angeles County Psychological Association and at the Center for Healthy Sex. She has been featured as a speaker on current transgender issues at the Empowered Trans Women Summit, has developed the comprehensive overview of transgender experience course offered by the online training program Loveology University, and writes monthly on issues related to gender on the Transformed blog. She is the founder and facilitator of 2 free monthly support groups for trans women and trans men. Thank you so much for joining us today, Natalia, or Dr. Z.
Thank you. Thank you for having me here.
Yeah. And so can you give the listeners an introduction to male to female transgender basics?
Sure, absolutely. I think for starters, it would be important to talk about what it entails to be a transgender individual. And I think transgender today generally encompasses a pretty broad umbrella term under which a lot of gender diverse individuals tend to cluster. For the sake of today's conversation, what I would mean by transgender, and specifically male to female transgender, is an individual that was assigned a male sex at birth, who does not feel comfortable or congruent with their assigned sex and desires to transition to a female gender.
Okay. And yeah, we had talked about this before the podcast. We could probably do an hour on each situation.
Right.
So maybe we'll come back and talk about this. But for today, we are going to be really focusing on male to female.
Correct. And to clarify even further, today what we would be focusing on is not just only male to female, and I think the better terminology perhaps to use is a trans woman.
Okay.
Or a trans feminine person. But we're also talking about a pre-operative individual. So in other words, we're talking about trans women that are transitioning or have transitioned and present as women, but for whatever reasons, either personal or financial or otherwise, have chosen not to undergo gender confirmation surgery, also known as a bottom surgery.
Okay. And that, to my understanding, is the norm, correct? Or the majority of transgender women don't get bottom surgery.
Don't get bottom surgery?
Yeah, or they do. Or are there numbers on that?
I think it depends. I think generally the way we look at transition, and what I mean by transition is usually the process that individuals undergo in order to get closer to the gender they are. And transition may usually entail social transition, which is coming out to family and friends, legal transition where you change your legal paperwork, and then there's the medical and surgical transition, which what we'll be talking today about. And that can be anywhere from taking hormone regimen to kind of undergoing very surgical procedures in order to get your body aligned as closely as possible to your desired gender.
Mm-hmm.
And I think one of the misconceptions is that transition tends to be a linear process, and is that the end goal for trans women that we're talking about today is to fully align their body with the desired gender. And I think what we're finding out today is that that's really not the case, is that transition is a non-linear process, and there's a lot more individuals, a lot more trans women today that desire not to get a bottom surgery or not to get other surgical procedures, and perhaps maybe they'll just undergo a hormone regimen and that's pretty much it, or a mixture of all above. I think that's becoming much more common.
Okay. And it goes without saying, like, this is not a familiar territory for me. And that was one of the reasons I wanted to have you on. And it gets talked about a lot in the therapy community that people who don't specialize in working with this population really probably shouldn't try to fake it. Like, this is Dr. Z has a lot of experience in this area. And as I said in the introduction, has a free drop-in group a couple times a month. And this is your field. And this is something that, like, I've heard from multiple practitioners that you want to do your homework.
Absolutely. And I strongly stand by that. I think that, unfortunately, today we have a lot of clinicians that do everything, and I think it's impossible to do that. I think it's important to focus and have specialty. And, Tim, it's completely okay not to have much knowledge in this. Again, your field is sexuality. And I think it's great that you are open enough to have somebody like myself to be interviewed, to kind of expand not only your understanding, but the audience's understanding as well.
So you started to talk about hormone therapy. And for trans women, are we just talking about adjusting levels of testosterone, lowering testosterone levels, raising estrogen levels, or what all is involved?
For trans women, the hormone therapy regimen usually entails, for starters, what we want to do is we want to kind of suppress or bring testosterone levels down, right? So we do that by introducing anti-androgens, and that's usually either spiral or biglutamine. And then what we want to do is we want to introduce estrogen. So that way we can enhance secondary sex characteristics of desired gender, in this case, female. And sometimes we'll introduce progesterone to further enhance secondary sex characteristics. And the hormone is really usually the initial step in transition, and a very important one, because not only does it give a physiological alignment or closer alignment of your desired gender, but also it has a psychological effect on bringing you even closer to congruency with your desired gender.
Okay. And is estrogen more common than progesterone, or is it about the same, or?
The estrogen is not only common, but it's a very vital part of hormone regimen. Progesterone is an add-on hormone.
Okay.
And progesterone can do really wonders to some people, and for some people it doesn't really work. But progesterone really further helps enhance secondary sex characteristics. For example, primarily really helps maybe expedite breast growth in some trans women.
Okay. So, but if estrogen's going up and testosterone's going down, erections are going to go down.
Correct. And that's
which is why we're here today.
Right, exactly. And we're really talking, I think, for trans women or gender diverse people listening to this conversation, what I would like to talk today about is trans women preoperative who have not had surgery. So in other words, trans women that still have penis, who really do want to engage in sexual activity, but cannot because their sexual organ is no longer functional. And so we're talking about really two subsets of trans women, one that feel comfortable with their penis and one that feel incredibly dysphoric about their penis.
Okay, good word, dysphoric with their penis. How might a layperson describe dysphoria?
If I were, what comes to the top of my head when I think about dysphoria is an incredible feeling of an incredible discomfort.
Okay.
A kind of a deep-seated discomfort that is persistent and consistent and does not go away.
And as you say that, the audience can't tell, but you're really looking inward. You're really thinking about it. And I get the sense that you've heard a lot of stories. You've heard a lot of people really open up about this.
Yes, I think, well, dysphoria is incredibly predominant in gender community. That's really the origin of these issues, right? To feel completely incongruent in your body feels incredibly dysphoric to these individuals. So imagine yourself, Tim, for yourself and myself, who take our gender for granted. We almost never really think about our gender per se. We wake up, we put on our clothes, we never really have to question our gender, right? Mm. So imagine yourself waking up one day and having this feeling of incredible discomfort about your body.
It is really hard to imagine. And would it be like feeling like my penis doesn't belong, like attached to me?
That would depend. So dysphoria is different for everybody, and everybody has a different sense of dysphoria. As society, when we think about dysphoria, we think about a classic trans narrative, which goes something like, I'm a man stuck in a woman's body. Well, the truth is that narrative no longer applies. Most individuals don't really feel like that. So they feel a range of feelings, and dysphoria tends to range from really severe to less severe, to I'm being dysphoric about my penis, to I'm not dysphoric about my penis, but I am dysphoric about my facial hair, or about my bone structure, or my Adam's apple, or my voice. Mm-hmm. So it really depends. And that's why it's important to remember that transition is nonlinear, because there's some people that feel comfortable with their penis. For example, some subset of trans women we're talking about today who don't want to have surgery, completely comfortable, and are sexually functional, and have zero dysphoria about their genitals. Mm-hmm.
Okay, and would you know off the top of your head, like the rate of dysphoria and people who identify as transgender women, or is it
in a sense of
like half or a quarter? Yeah, like percentages
of individuals who have gender issues who suffer with dysphoria?
Yeah,
I would say the percentage is pretty high.
Okay.
Whether it's dysphoria about their genitals, that would be hard to pinpoint.
Okay.
But there will be dysphoria nonetheless.
Yeah. And is that something in treatment that, what are you doing with that? Are you trying to like help someone become more congruent, or are you helping someone transition?
Both, right?
Both.
So transition is a pathway to congruency.
Okay.
So really essentially what I'm doing is I'm helping an individual. First of all, I'm helping them identify what their gender identity is. Mm-hmm. And once we identify that, I help educate individuals what entails transition. Because again, it's not one size fits all. There's some people that, very comfortable with starting hormones and having a few surgeries. And there's some people that really want to go from one binary strictly into another binary and to be as congruent as possible. So it really depends.
Okay. So let's talk about it then. So with congruent individuals who suddenly are taking much higher levels of estrogen and presumably that leading to struggles with erections, what happens? What's that like?
Well, I think what happens for those individuals is struggles in relationship and intimacy. Because here we have a group of trans women that are fully comfortable with their penis, who are sexually active or want to be sexually active, whether it is through penetrative intercourse or oral sex or any other forms of sexual intercourse, really. And what we're seeing is that because of the introduction of estrogen and anti-androgens that bring down the testosterone levels, we're seeing a struggle with being able to obtain erection, being able to maintain erection, and that can really interfere with the sex.
Okay. Now, is it often that trans women need a hard penis? Is that typical for trans sex?
It depends. I think it depends what your sexual preferences and what your sexuality is. For trans women that are attracted to male sexual partners and who are sexually interested in penetrating those male partners, right? That would be pretty important. For trans women that are interested in either male or female sexual partners and are interested in oral sex, that would be a pretty big deal. So I think it really depends on sexual preference. I don't think there's such a thing as trans sex. I think there's just sex. And then I think there's just us and how we see ourselves in the context of that sex.
Okay. That's really well said. And so that is kind of, I mean, it sounds like this whole process would be pretty overwhelming just in general. And now to add on sexual complications on top of that.
Right. And you're absolutely right about that, because imagine even if this trans woman per se doesn't feel any dysphoria about her penis, right? But she feels a very strong, let's say, dysphoria about her breasts or her shoulders or her buttocks, right? So she's already feeling some element of discomfort with her body. And then on top of that, she realizes that her penis is now non-functional. That can add another mix into that.
Sure. And that's the last thing you want to do, is be in your head during sex about all these different parts of your body, whether it's your penis or your shoulders,
Right.
and to really be in your head about that. So what does this kind of thing come up in the groups that you run? Or are people usually talking a lot about sex and what goes on? And
in the groups that I run, I tend to get a mix of trans women that, for majority part, don't really feel comfortable with their genitals. And we have to keep in mind that for a lot of trans women that cannot get the surgery but want surgery, a lot of them do feel very dysphoric. And so to have erectile issues is actually a relief. So that's another split of the coin, right?
Right. Like, thank goodness this doesn't work. I don't want this thing anyways.
Exactly, right. But for those who really don't want to be sexually functional, this becomes a conundrum. So what do I do here? So in a way, we really want to work with these individuals and helping them redefine their sexual roadmap and their kind of recontextualize the way they see themselves and the way they see their body and the way they see their sexuality.
Okay. And so give us some of that recontextualization. Like what are some of the things you're trying to help these women understand about themselves?
I think one of the things that I try to do is shift them away from this focal point of my penis is the primary functional sex organ to how can you still get sexual pleasure and sexual orgasm? So what other parts of your body are sexual? So for example, with breast growth, nipples can become very sensitive and very sensate for a lot of individuals. What about some areas of your neck? What about other types of sexual intercourse that does not include penetration? So you really try to, in a sense, broaden out their understanding of sexuality and shift them away from this kind of fixation of the way I relate to my sexuality is through being able to use my penis. And now that I no longer can use my penis, I can no longer have sex. So in other words, sex doesn't have to stop when the penis no longer malfunctions, right? Sex continues. And and same thing we do with, for example, males who have erectile issues, right? We teach them that, well, sex doesn't have to stop at, your penis not getting hard. It can continue. It's just different types of sex.
Different types of sex, right? And I think that's what the current sexual education movement really is, redefining what sex is. And that's happening. And the groups that you run and the people that you work with. So one other thing, well, I was wondering about the partners. And are you often helping individuals help re-educate their sex partners as to how to have sex with them and be sensitive? And
yeah, that's a great question, Tim. Absolutely. I think that if there's a partner involved, that becomes a huge, usually in those cases, to be honest, I refer them out to people like yourself who specialize in sex therapy, because I no longer really focus on sex therapy and I just primarily deal with, kind of a gender issues of individuals. But absolutely, I think it's really important when I talk to sexologists and I educate them about how to work with this population. That becomes a very significant point to bring in the partner, to educate the partner also about erectile difficulties that the couple will face with the introduction of estrogen and anti-estrogens, and to kind of help them also reshape their sex life. So if the partners, for example, is a female, right? So we're talking about trans woman and a woman partner. And if they always had penetrative vaginal intercourse, right? Well, what can they do now? if your partner can no longer penetrate you with a penis, can your partner penetrate you with a strap-on or with a dildo? And what does that mean to you? So helping them also navigate and reformulate their sex life is really important.
And would you say that a lot of the people that you're working with, even in longer term relationships, are experiencing comments from their partners, microaggressions and that kind of thing, just insensitive comments?
Oh, that's a good question. I think yes and no. I think it depends on the partners, and I think it depends on a lot of factors. So it depends how long they've been together, how much what I call emotional traction they have as a couple, right? How soon after being together the partner came out, how receptive was the partner. But it is common that sometimes I do see partners being what you describe, kind of microaggression, right? I do see, especially that in a lot of female partners, where there's this feeling of I have lost not only my husband or my partner, but I have also lost my sexual partner. And now not only do I have to transition with them, but I also have to transition my sex life with them.
And so how do you deal with that?
Well, I think the trick is how to tread the water very lightly and gently, because we want to, essentially what we want to do is we want these couples to thrive, right? We want them to have less friction and more cohesion. And I think the way to achieve it is what any really good couples therapist, again, I don't see couples really, but any good couples therapist does is treading the water lightly and being knowledgeable and educated about gender issues. And also how transition not only affects the primary person who is transitioning, but a partner as well.
Yeah. And so that question of like, how do we have sex now? When somebody transitions in the middle of a relationship, is that usually the question, or is it more often that they'd already been having sex that was the kind of sex that the eventually transitioning partner wanted to be having, or does it usually change significantly, the sex and that kind of relationship?
You asking is the sex changes relationship?
Yeah.
I think it can. I think it depends on a couple basis on how couples are sexually open or receptive. So if, for example, and we're using now, again, we're kind of using a stereotypical, trans woman and a woman partner, right? But for example, if for that female partner, if she has been used to and sees her orientation about sex is only penetrative intercourse, then bringing something else, even sexual toys in the bedroom, can be very uncomfortable. So changing the sexual map of this couple can also change sexual inner views and values and maybe even morals around this individual sexuality. So it's really can shift and rock the boat, so to speak, but what doesn't in our lives?
Right. Well, yeah, no, I'm just thinking about how, so if a trans woman was using her penis to penetrate for a long time, I mean, is she often doing that and not wanting to do that and maybe can't tell her
right,
wife?
And sometimes that happens, right? So sometimes we have people who are dysphoric about their genitals. And so here we have a couple and suddenly the partner is very dysphoric and suddenly does not want to engage in sexual intercourse at all or any kind of sex. And suddenly the partner can feel very alienated and very alone. And I think what happens is, unfortunately, I think a lot of these couples forget to really communicate and ask questions during these times. And I can understand why, because transition can be often confusing and a difficult process for both of them. And in the midst of everything else, I think people are less likely to be flexible and receptive and say, well, let's talk about our sexuality. We haven't had sex in a month. What's going on? I know that, because of estrogen, your erections, will diminish. I also know you feel dysphoric about your penis, or you don't feel dysphoric about your penis. How do you feel about that? And I think that's where people like yourself and sex therapists really come in. And I refer couples a lot of times to sex therapists for those reasons, to open up that conversation.
Right. Yeah, because those are hard conversations for everybody.
Absolutely.
And even that question that you pose right there is pretty blunt, but crucial. So, sweetheart, what do you want me to do with your penis? Right?
Yes.
And have you been not feeling great about putting your penis in me for a while? Would you rather we did something different?
Right. And vice versa, right?
Right. And vice versa. And just getting to a level of comfort and sensitivity to those kinds of questions and answers, because you have to be able to say it out loud.
You do, and you'd be surprised how many couples don't. And I think what happens...
I'm actually not surprised.
You're not surprised?
Yeah.
You hear that a lot.
Right.
I think what happens for the partners of trans women, whether the partners are male or female, or bigendered or any other gender, I think what happens is people feel terrified to ask the question that they feel is a very sensitive topic for that person. Mm-hmm. And what they do is, which you probably know, is pretty quick to assume. Mm-hmm. They assume that, because you're transitioning, you must be very uncomfortable with your penis.
Right. You just want a bottom.
And that's not the case for everybody.
Right.
Right? Or because you transitioned, you're so dysphoric, I can't even touch your genitals. Mm. Again, not always the case, right? Mm-hmm. So suddenly communication goes out of the window. Mm. And this couples tend to really suffer.
Right. And now I'm thinking with my sex therapist cap on that. Okay, well, when we're talking about sex, we're talking about touch and joy and intimacy, and these are the things that people want out of intimate experiences. And so we got to make sure that people are doing all that, all the foreplay, all the cuddling, all the caressing.
Right. We want to bring play back into the bedroom, right? We want to bring experimentation and fun into our sex life. Mm-hmm. We want to move away from stagnation into movement. And so I think it's important to look at the transition as everything is going to transition. Your body is going to transition. Your mind is going to transition. Your partner is going to transition with you. Guess what? Your sex life is going to transition with you as well, for sure. Right? So it's important to put that cap on and help the client see it from that perspective.
Everything's going to transition.
Yes.
I like that. That's really good. So what are some of the struggles that transgender women face? What are some of the more typical struggles? I
think one of the bigger things that probably would be struggling, which is, I think became quite apparent now, is a sense of dysphoria, right? Mm-hmm. And I think one of the things we don't understand is how dysphoric it can be when somebody gets misgendered. I think misgendering is crucial. I think especially for trans women, when they start transitioning, for a lot of trans women, there's going to be a part in between when they're not going to be passable, or they're going to struggle to pass as women, right? And I think the biggest thing to understand for the public is when you come across somebody, anybody, whether they're transitioning or even not, whose gender is ambiguous to you, remind yourself that even though we live in a society of binary, and we still think in a very binary realms, there are a lot of expressions to gender. And just to be careful not to gender individual, you'd be surprised how easy it is actually to have a conversation without gendering anybody. Mm. All you have to do is just use the person's first name. Pretty easy.
That is easy. Dr. Z. Huh. One thing that I often think about, though, when thinking about this topic is hormones can be nasty, can be really intense in affecting a person's personality. We see this most often in society when a woman goes on the pill for whatever reason. There can be major changes to how somebody feels. And I always like to cite the study where they were trying to find hormone therapy for guys to as a form of birth control, and they can't get through the studies because the guys wouldn't finish taking the damn hormones because it was just messing them up too much, and gives us some insight on what women have had to deal with for years. But that's got to be kind of intense to suddenly be throwing like all this estrogen and sometimes progesterone and other supplements in your body. And so what happens to a person's personality and sense of themselves and all that?
And I think it can be. I think intensity really will vary. I think we have to be careful to stay away from kind of gender stereotypes that estrogen will make, a trans woman more emotional or sensitive, or she's going to cry all the time, and testosterone is going to make a trans masculine person aggressive suddenly or have an angry outburst. And I don't really think the hormones necessarily do that. There will be changes for sure. For starters, you'll feel much more congruent because the way I see gender dysphoria, my understanding of gender dysphoria is that it's a medical condition, not a psychological one, meaning it's not a psychiatric disorder. It's medical, genetic. People are born with brains that are more in alignment with the gender that they really want to be versus their assigned sex at birth. And so as a result of that, there's this big incongruency that happens, right? And so if we introducing estrogen, for example, to trans women and reducing their testosterone, suddenly their brains are more in alignment, right, with their gender. And suddenly the turbulence that they may have experienced having testosterone going through their body is no longer there. And that can give tremendous relief, right? And that can be intense for some people, but I think it's often not. I think if anything, it's a sense of really a peace and relief within yourself. Having, the hormone that was meant to be there to flow through your body. It's a big deal. Pretty powerful, actually.
I bet. And I'm thinking, one of my favorite words in psychology is congruence. And in just thinking about that sensation of the inside being the same as the outside, and that alignment and feeling at peace with yourself. And that does wonders for anxiety reduction. Right.
And also when you think about the word congruent, it's such a subjective word, right? So what congruent to you may not be what congruent to me. And I think that's one of the things to keep in mind when working with this population is that just because a person identifies as a trans woman and you automatically think, congruency for this person means, a full transition, including a bottom surgery, that may not be what congruent for this person. So congruency also varies, and it's a very kind of subjective sense of who we are.
But once they've gotten there, once they feel that authenticity and that like themselves, probably easier to do life, but also easier to have sex, also easier to obtain erections if that's
absolutely. Suddenly all this pressure is lifted off, right? Imagine, if you will, your brain right now, and imagine struggling with dysphoria. Now the dysphoria will occupy an enormously big part of your brain capacity to the extent where you will really struggle with maintaining attention, with trying to do your job, with trying to deal with day-to-day things, and on, including your sex life, right? If dysphoria is occupying such a big part of your brain and you're not out yet, or you're not, comfortable with your gender yet, that's a pretty big deal. That's pretty difficult to do.
Yeah.
And once we introducing hormone or we introduce any kind of transition that is starting to get person to whoever they see congruency, all of that space is cleared up. And suddenly a person can suddenly focus, people can suddenly go off living their lives and finish, the degrees they always wanted to complete, and so forth and so on. So it is a really big deal, sense of congruency and sense of self.
I bet. As you're talking about that, I'm kind of putting myself in that position and just thinking, God, to have such a constant source of anxiety, really, how I wouldn't be surprised if the erectile issues were really, really common, just with all of that in a dysphoric person.
Right. So yes, you bring out a great point, right? How often do our anxieties interfere with our sexual response period without incongruency, right? Let's look at just cisgendered men. If you're anxious about your work or your finance or whatnot, chances are you're going to have a hard time getting erection. And now imagine you're feeling really uncomfortable about your body.
Right. Which happens at work, at home, everywhere.
Yeah. And where some of the things are kind of, where's your anxieties about your work or finances is something that is not seen to everybody else. It's kind of invisible. Your gender is pretty visible handicap because everywhere you go, people relate to you based on how they see you. And if you are not transitioning yet, then people see you how you do not want to be seen. And that's pretty painful existence from day to day.
That is, but is there, like with regular anxiety, it fluctuates. You know, even a person with generalized anxiety disorder is going to have good days and bad days. And would that apply to dysphoria as well? Would there be days where you're just not as preoccupied by it and might be able to just kind of be okay with who you are? And
Sure. That will also vary from individuals, right? And yes, you're right. And there will be some days for some people where they have accepted that they live in a binary world, and while they're transitioning, they will be misgendered, and that is okay. That will happen, right? And then there's going to be some days where any little sign, any little misgendering you get can just really spiral you into a sense of depression or alienation or anxiety. So yes, it absolutely will vary. And I think the more you have support and the more you have people around you that are, kind of there for you, the better off you're going to be.
And I bet, like with most psychological issues, it's a two-way street where if you just are anxious because you have a really intense job and because you haven't been sleeping and because you're having relationship problems, that might ramp up some of your dysphoric feelings or your experienced sensitivity to microaggressions out in the world.
Right. Yeah, absolutely.
Okay. So what do we do? Right. So, you're not a medical doctor, but I'm sure you've at least heard anecdotally about taking Viagra on top of hormones and,
Sure.
and people running into any issues around that.
Not that I know of. And, to put the anecdote aside, I actually did inquire with medical professionals who work with this population. So if I do have a trans woman patient that, would like to be sexually functional, can I introduce erectile medication into the mix? And the answer is yes, absolutely you can. Doesn't seem to be any contraindicating points from medical standpoint. Will that work for everybody? I think that depends. It may not. And another thing to think about is there will be a group of individuals who just don't want to add another medication to their mix, period. But that is a very kind of simple, streamlined solution if it works for those trans women that are comfortable with their penis and want to be sexually functional.
Okay. And Dr. Z is going to put this podcast on her website and blog, and it's going to get promoted through various channels. And if anybody out there is listening, I've done already like 16 or 17 episodes on different ways to approach erections. And a lot, I've talked to some pretty big psychologists about it. And a lot of those tips around mindfulness and relaxation and having good conversations with your partner are also going to apply.
Absolutely. I think that's a great point you bring out, and I'm glad you do that. And I hope that if anybody snatches this off my blog, which is called Transformed Blog, I hope that they also go and listen to your other podcast because it is absolutely relevant, because we're talking about an erectile issue that whether it is for trans women or cis men, it's still an erectile issue. Right. And I think the tools that we can apply can be very usable across the board and very important. And again, I'm not a sex therapist, so my toolbox is very limited when it comes to that. So it's important to go to people like yourself and get those tools from you.
Yeah. And so what about, I was thinking when we were talking about, a doctor and recommending Viagra and things like that, I'm wondering how that experience is. Like we're in Los Angeles. Dr. Z is based in Beverly Hills and I'm in Silver Lake. And I feel like here in the community that we know each other from, we know of trans-friendly doctors. Right?
Right.
Like,
yes. Well, we do and we don't. There's definitely clinics that have become much more trans open. For example, UCLA has a great trans program. Cedars-Sinai has a great trans program, right? State John's does. All of those clearly listed on my website under gender resources for people who are interested. But there are going to be medical providers that maybe not going to be as knowledgeable, and that's okay. That's why you get an education by talking to your sex therapist about your erectile issues. And your sex therapist can say, well, have you considered an erectile drug? And that's when you go to your medical provider and, find out if that's kind of a medically viable option, right? Because my understanding is that that's also may not be for everybody based on their medical conditions.
Right. And for various reasons, Viagra, sildenafil, and the PDE5 inhibitors were originally intentioned as heart medications, and they still they're Cialis. Some people just take daily Cialis, honestly, more as a heart medication, and then there's the added benefit of erections, and so that's a whole other topic and field. But I bet LA is probably like a decent place to go and see doctors, but it's probably not like that around the country and certainly not around the world.
Yeah, I think LA is definitely much more accessible. And I think that's a very easy kind of fix. I think the bigger challenge, Tim, really is for trans women that want to be sexually functional and for some reason cannot get the surgery. Usually the reasons are financial, or you have some medical conditions that preclude you from getting surgery, and yet have incredible dysphoria, right? I think it's a little bit easier to work with trans women that don't have dysphoria about their genitals to reshift that paradigm. But what do we do with trans women that are incredibly dysphoric but want to be sexual function?
Right. Wow. That sounds really complicated, right? So, and dysphoric in the sense, would you mean specifically dysphoric about their genitals?
Correct. But still want to be sexually functional, right? So you have a trans woman come to your office that says, I transitioned and I can't get a surgery. I want to get a surgery, but I can't. I just can't afford it. Or I have medical conditions that prevent me from getting it. And I'm here with a penis that's not functional, and I don't feel good about it. I hate it, but I want to be sexually functional. So how do I do that?
Yeah.
million dollar question, right? I think one of the things that I try to help sex therapists understand is, apart from just shifting the paradigm of sex life, right? Also having an anatomical understanding of male genitalia, and anatomical understanding of what happens during vaginoplasty. Vaginoplasty is a procedure where the neovagina is created, right? And that's the surgeries that this individual in this case cannot afford or cannot get. And why is that understanding of the construction anatomy so important? Well, you can really help a person understand that although you have dysphoria toward your penis, perhaps because you have all these masculine associations to it. It's a penis, so it's a sign of masculinity and manliness, and I hate it. Every time I get an erection, it reminds me of a man I once was, right? Let's talk about if you were to get vaginoplasty, right? This part of your penile skin or scrotum skin is going to be your internal depths of your vagina. And this part is going to be your labia. And this part is going to be your clitoris. So just kind of reorienting the understanding and the ways they view their genitals even, I think it helps tremendously.
Teaching them to love their penis.
And also reframing it. Because truly that's what happens during surgery. For example, during penile inversion, that's what happens. I mean, the surgery is really not performed in a way where the penis is just castrated and then a new vagina is plastered on. All of those parts of your penis are used to construct new vagina.
What is going to be the clitoris?
So the penile gland becomes clitoris, okay? And then the skin of the penile shaft and sometimes part of the scrotum, depending on what doctor likes to use or how they like to do the procedure, really. It becomes your depth, becomes your canal, your vaginal canal. So you can see how talking about that and shifting the narrative from this is a penis and this is my shaft and this is my scrotum to this is actually what makes labia and this is actually what makes...
Well, wait, what makes the labia?
Well, again, it depends on what surgeon would like to use, right? Okay. And sometimes people will go for a second procedure, which is called labiaplasty, which is actually a construction of labia to make it look much more like female vagina. So it depends how much skin people have, because shrinkage is, again, very common on estrogen and testosterone suppression. But I think the important thing here is to remember how to shift that narrative from seeing it just as penis to...
my eventual vagina.
Absolutely, yeah. That's one way to put it, yeah.
And that's really empowering.
Very much so. And I think people who do, especially people who do any kind of body work, right, with this population or any kind of sexual body work, having that understanding in working with the segment of population is really important. Like you said, incredibly powerful.
Yeah. Yeah, that congruence and that just self-love. Because you've got to love your body and love yourself in order to be in a loving sexual relationship.
Yeah, absolutely. Very important.
Yeah. It's one thing if it's casual sex or a one-night stand, but, we're talking about it over the long term. I'm sure people can drug themselves out of gender dysphoria just like any anxiety, over the course of a night. But in the long term, you have to come to a grounded self-acceptance in order to have regular, gratifying sex.
Yeah, and sometimes, I tell people, look, it sounds like surgery is for all of these reasons is not a viable option here. It sounds like you're a human being and you're still going to live and you're going to be intimate and you're going to engage in lovemaking. And I think it's pretty painful to continue to hate yourself and hate your penis every single time you have to engage in lovemaking. And I think it's really unnecessary because all this association really that we have to what constitutes and what penis represents are just social constructs. That's really all it is. Just our social narrative. Doesn't mean it has to be that way. And it doesn't mean that your narrative has to be that way.
Yeah. So if we take that social construction out of your relationship to your body, it's really nice. You get to determine what you want your genitals to mean.
Yes. I think analogies to one of the kind of a simplified analogies that comes to mind is women and penis envy, right? Whether Freud was right on it or not, I doubted he was. I don't think many women, if any at all, have penis envy. But let's hypothetically, for the sake of this analogy, say that people do. Understanding that your clitoris is essentially penis can be very powerful. And that's now, if we were to think about the reverse, right? Talking about the trans men that have not had bottom surgery, having that understanding that their clitoris is a penis is very powerful.
I bet.
Yeah.
Okay. I'm really liking this. I feel like I'm starting to
You're starting
get some
to map.
things.
You're starting to broaden your understanding, and that's why we're here, right? That's why we're having this hard conversation.
That's correct. Huh. So do you feel like we've done a good job of covering the things that you were hoping to communicate, at least in this hour?
I think we have. I think my biggest point in this conversation was to help people understand that there are trans women that feel very comfortable with their penis and want to be sexual. And there's trans women that have a lot of dysphoria, but still also want to be sexually functional. Now, of course, we, in a way, we kind of eliminated trans women that do not want to be sexually functional, do not want to, and that's okay, because that's not what we're addressing here, right? Again, it's important to remember that one size does not fit all. Everybody's gender and their transition and how they see their sexuality in relationship to transition is going to be drastically different.
Right. And as we said at the beginning of the podcast, we haven't really spent much time talking about transgender men today. And so can you summarize 1 hour in like a minute? like what would we talk about if we had a conversation about that? Like what would be some of the basics?
Oh, well, I think in a lot of ways, maybe it would be somewhat similar, right? We'd be talking about trans men that have not had phalloplasty, metodioplasty, which is the bottom procedures for the trans man, who some of them want to be sexually functional, right? Although, for those who feel very comfortable with their vaginas and have no interest in getting bottom surgery, right? That would not really necessarily be a problem. I mean, the only problem that they would struggle with on testosterone is that they will have dryness, so their vagina would not be lubricating as it once was on estrogen. And so just to remind yourself to bring a lubricant in the bedroom. I think the problems are going to be slightly different. I think the understanding is going to be different. So hard to summarize, Tim. I don't know what to tell you. Maybe another conversation.
Yeah. Well, no, and I'd want to talk about like the functionality of that penis, like after an operation. And if I think that's probably a pretty common question, but also, normalizing people who are going to just keep their vaginas, and that they'll still have to have those conversations about, okay, even though there's a strap-on or whatever toy we're using, I would still like you to play with my vagina and still, stimulate me in those ways. And that person would probably still have to learn about loving their vagina, even if there was dysphoria and reframing all of that. And
right. Absolutely.
Okay.
Yeah.
Well, we'll see if there's a huge demand for this. And so, like I was saying in your intro, you run a free drop-in group, which after this podcast airs, there's probably going to be a really long waiting list.
Well, I don't know. My trans women groups that I started about 4, maybe even 5 years ago now, already has a wait list every single time. And that's a pretty popular group, and it's a free monthly group. And it has kind of a solid group of women, and that's a really great group. I have started a trans man group just recently this year that I'm still working on building up. So that's another free monthly support group. Now that one might get a wait list after this conversation, hopefully.
Yeah, and I suppose I should have asked you this at the beginning. Maybe I can just edit it, but why did you take an interest in working with this population?
Tim, I have always been the type of person that likes to fight for underdog. And I think in many ways, we live in a society where we're so ignorant about gender and understanding of gender fluidity. And as a result, we tend to really marginalize people that express gender other than binary. And as somebody that likes to fight for underdog, that just kind of tickles my feathers.
Yeah. Okay.
And I think that's why it's important to mention for people who are listening, for any gender diverse people, is in my way of supporting community, what I do is I do all the trans surgical evaluations for any trans surgical procedures completely for free. So if anybody listening to this and needs a letter, they're welcome to just email me or call me, and I'll do it for free. Again, that's the underdog in me.
Yeah.
Yeah.
For free. I don't know how I feel about that. Just from like a work-life balance. Do you work like really long hours? And
I do. I work 5 days a week, probably like yourself. I have Mondays and Fridays are my days off, and I'm fortunate to have a good private practice.
Okay.
And I noticed that this is something that a lot of people need, and there's not a lot of clinicians that are skilled in how to appropriately evaluate and do a letter write-up. And apart from me, there's really just only another clinician in LA, as far as I know, Aidan Kennedy, that does them also for free.
Okay.
And I think it's really important service to the community. And I think as clinicians, as psychologists, we should be able to also give something back to community.
Well, that's awesome and admirable.
Thank you.
And thank you for doing that work. That's really crucial. That's really, really important work. And so, yeah, like she's saying, if you need that letter, reach out to her. How can people find you?
The easiest way to get a hold of me is you can just drop me an email at nataliadrzphd.com.
nataliadrzphd.com.
Yes.
Okay.
Or you can just drop me a text at my number.
Okay.
310-946-6361.
Wow.
And all you have to say is, hey, I heard your podcast and I need a letter. And you said it's free. So let's get together.
All right. Okay. Well, and do you do social media stuff?
I do, in the sense that I do have an Instagram page.
Okay.
It's Dr. Z PhD.
Dr. Z PhD on
Right.
Instagram.
And then the Facebook page is under the same name. And that's pretty much it. I do try to write regularly on my blog, Transformed, on gender issues. And last week I wrote about progesterone and why trans women should consider progesterone. So I do try to write pretty regularly.
Okay. Well, awesome. Thank you so much for coming out today.
Thank you so much for having me here today. This was fun.
Okay, good. And yeah, maybe we'll have another conversation about this. Okay.
Great.
All right. Well, thank you. Thanks to the show's executive producer, Robin Morrison. Thanks to Kat Murphy, director of social media. Thanks to Team Scrub for the music. Thanks to the sound engineer, Ravi Carmen. Thanks to Brian Hui for naming the show. Thanks to Alex Pitts for the intro. Thanks to Arlene Asuncion for the logo. You can find this podcast at hardconversationspodcast.com or wherever you get your podcasts. You can locate me on Twitter at TimNortonLCSW or on my website for my private practice, timnortontherapy.com. You can also email us at hardconversationspodcast@gmail.com or call into our hotline at 662-626-4276. That's 662-MAN-HARD. Thanks to all my friends and family for brainstorming this show with me. Shout outs to the sex positive community, including sex educators, sex therapists, sex coaches, other fellow sex podcasters, sex surrogates, academics, the sexual health medical community, sex workers, the tantric community, and everybody else involved with having hard conversations. Bye-bye.